Hi, I'm Marissa. I'm one of the dental assistants here at Dunn Orthodontics. Congratulations on getting started with your new braces. Today we are going to talk about how to care for them now that they've been placed. Over the next couple weeks, it is pretty natural and normal to experience a little bit of discomfort and soreness. A pain reliever and some soft cold foods can help with that. Over the next couple weeks, your cheeks and your lips are going to callus over, which will help protect you from your new braces. If you are sore, alternating pain reliever and soft cold foods can help with that. And all the braces are completely dry the day you leave, so you can eat whatever you're comfortable with. However, most people do like to start with the softer foods. We will be sending you home with a care package. Everything I'm about to show you will be sent home with you on the day your braces go on. You will be sent home with an electric toothbrush. We do recommend brushing with an electric toothbrush at least twice a day for 2 full minutes. And the most important thing when it comes to brushing is technique. With your electric toothbrush, it is very important you brush 4 different angles of the braces each and every time you are brushing. The first angle is the simplest, flat, right on top, right in the center of the brace. Next, you're going to angle your toothbrush head up and go on the bottom side of the brace. And the area that probably gets forgotten the most is the top edge. So you're going to rotate that angle up and brush the top shelf of that brace. You're going to, of course, still brush your chewing surface and your tongue as well. So once again, those 4 angles, flat right on top, angled up, bottom side, and the top shelf of those braces along with your chewing surface. Also in your care package, you'll be sent home with a travel toothbrush. Great for bringing to school or on vacation, keeping on you so you can brush whenever you would like to. You will see an itty bitty toothbrush head. Now this one here is called a proxy brush, and a proxy brush is used to get underneath of that wire where that big brush head cannot get. The proxy brush is flexible, and if you'd like to put toothpaste on it, you can, and you can go either from the top side or the bottom side here to scrub out underneath that wire. And I would do that at least once, if not twice a day, to make sure you're fully brushing your teeth. In your care package, you'll be also receiving a package of gum. Any type of sugar-free gum is perfectly fine to have with your braces on. Dr. Dunn will also send you home with a bottle of fluoride mouthwash. A fluoride mouthwash helps protect your teeth with your braces. Same thing, any brand or flavor is just fine as long as you're using that once a day. You'll be sent home with a few different types of toothpaste. This one here is called Enamelon. Enamelon is a special toothpaste that's used to help protect your teeth a bit more with your braces, and I would recommend just brushing with this one at nighttime before bed. There will be also a small tube of travel toothpaste as well, great for pairing up with that travel toothbrush. Your kit will also come home with wax. Now, over the next couple weeks, before those calluses are formed, your braces might feel a little rough and pokey. Wax comes in handy for anything that is long, sharp, or pokey. To use it, you simply roll up a ball of wax. In any area that's bothersome, you pat it dry with a napkin or a tissue, and you just roll the ball of wax up and over it. When you're done with the wax, you simply take it off and throw it away. Now, wax also comes in handy for any of those long wires you may experience. The wire is what's physically moving your teeth with braces, and as the wire moves them, it will extend out the back and potentially feel a little sharp. If that starts to become bothersome, you have a few options. You can call the office for us to trim that for you, or you can use your wax. It's the same process, pat it dry with a napkin or a tissue, and roll that ball of wax up and over that long area. Also in your care package, you will see a few different types of floss. This one here is a floss threader, and it comes with a little loop on the end. You can pair that up with your traditional floss. You tie your floss around it, and you can use that to get underneath the wire, which I will show you here next. The next type of floss you will see in your kit is called super floss. Now, super floss comes with a long plastic tip on the end, and your floss is pre-attached. That other one I mentioned, you just simply tie it off and it would become attached as well. As you can see with your braces on, you will need that special floss to get underneath that wire. You're going to use that pokey tip kind of like a sewing needle. You can use it from either the top side here or the bottom side. Either is just fine. Once you poke that pokey piece through, you guide your floss in. When you're flossing, it's very important to kind of draw the letter C around each side of the tooth. Then you're going to gently pull it out and move on to the next spot. Now, I know flossing can be a little time consuming with your new braces, but like anything in life, practice makes perfect. And flossing needs to be done at least once a day, and some people split it up, half in the morning, half at night. That's fine to do as well. Your kit, you're gonna also see your foods list. I'm sure you heard there are some foods you do have to avoid and alter with your braces on, and this list will be in your kit while you're sitting home with you today. Some of those foods you do have to avoid are things like hard, sticky, and crunchy foods. Hard foods are things like ice, nuts, carrots, hard candies, things like that. Sticky foods are things like taffy, caramel, Tootsie Rolls, things that are very chewy and you're doing a lot of chewing on. Some other things you do want to avoid are chewing on pens and pencils, chewing on ice, picking at your braces. Any extra pressure can break those braces off. Corn on the cob, perfectly fine to have. You just want to take it off the cob first before you bite into it. And same with meat that's on the bone, just simply remove it from the bone. Now, one other food I do want to highlight here of something to avoid is popcorn. Now, popcorn in itself is not hard or sticky. It's those pesky kernel shells that get stuck underneath your tissue. And there are kernelless brands of popcorn out there that you can have safely. Well, that about covers it for brushing. Once again, congratulations on getting started. We look forward to spending your treatment with you. One other thing I should mention as well, the question I get asked a lot is, how can I speed up my treatment? And there are a few simple things you can do to help speed this process along. One, avoiding those hard, sticky foods and avoiding broken braces. Two, good hygiene. Hygiene tremendously comes into play with these braces, so everything I taught you, using that daily. And the other thing is rubber band wear. So if Dr. Dunn has recommended you wear rubber bands, wearing those as prescribed is something that will move your treatment along. Once again, congratulations and welcome to the Dunn family.